Well, welcome everybody. I really appreciate you all coming out on this cold night. I hear it's going to get colder. I don't know if you've heard that or not. Maybe snow on Sunday. Yeah. So Well, we're really happy to have Barbara and her father Stephen here to talk about what you've discovered, right? And they have written it in their book, which it looks like you guys have gotten. And I'm really excited to hear how this came about. So welcome all of you.
Thank you very much. I'm Barbara West. I'm an estate planning and elder law attorney, and I've done some programs for the ALS Society before. This is my father, Steve Adler. And before we begin our presentation, and we don't have the PowerPoint to display to you tonight, I'm sorry to say, but we'll use it to guide our remarks. When I was younger, my dad said that if you're ever going to speak in public, you have to begin with a joke. So here we go. The woman, or her husband, hasn't been well, and his care has been challenging for her. So she does a great deal of research, and she finds a place where he's going to get great care. It's close to home. She brings him there for the first day. And of course, this is not what either of them want, but she's sure that this is the right thing. And she says, "Listen, honey, I have some errands to run. I'll be back in a couple of hours. You get settled in." And so he does. He's, gets his things around him, and a little while later he's sitting in his bed and someone comes in and they notice he's sort of drifted to the side, and so the care provider comes in and gently pushes him back to center, and a bit later he's drifted this way and someone comes in and gets him back in the middle again, and his wife comes in a few hours later and she says, "Well, what do you think? Is it great?" He says, "No, I don't like it at all." And she said, "Why? What?" He said, "They won't let me pass gas." And we laugh, but it is true, because we're all afraid that we will be put somewhere and no one will come see us except maybe once or twice a day, and all we'll get is that poking in the shoulder, and that's the care that we're going to get. I mean, people are afraid to leave home and to get care in congregate communities. And so my parents had to make this choice a long time ago, and we wanted to write about what we had experienced from my dad's perspective, because there aren't a lot of people out there who have gone through what he has. Now, I know that not all ALS patients are seniors, and of course our book was really written with seniors in mind. But I think the message applies to anyone who's facing a healthcare challenge, because we'd all rather stay at home. And so I think these myths apply as well to people who are fighting illness, as they do to seniors. So with that, my dad's going to tell you why we thought we could write this book.
Well, I was married to my wife for almost 65 years. We just ran a month or so short of hitting that milestone, and in the last several months before she passed away, I was having medical issues of my own, so I was taking care of her, and then when I couldn't do it properly anymore, Barb stepped in, and I was being taken care of elsewhere. She didn't really have to do much for me except keep me happy, but she had to really take care of her mother. So what we learned is what we present in the book, and Barb has already alluded to the myths. So we'll go into that in a few minutes, but let me just say, so I spent a lot of time taking care of my wife, and she of me, and so I have a perspective as the senior taking care of somebody who needed a lot of help, and she has a perspective both as the attorney taking care of people who have these difficulties, but also as a caring daughter. So we thought we had, between the two of us, really covered the waterfront pretty well. So let's see, I think we've got to put this thing, it's going to fall over.
We're going to put this down so it doesn't fall over.
It's going to fall. So, anyway, so we think the basic thing that we learned is that when people are unwilling to make a decision about their care, and the care can have many different facets, they're unwilling to do it, they're actually doing something. People think, I'm not going to do anything. I'm not going to write a will. I'm not going to this. But they're actually doing something. And what they're doing is postponing the time to make a decision, and they're actually, in some cases, losing options. And so when people buy a copy of the book, they don't always say, would you please write something in here? But when they do, I write in plan ahead, because I think that's crucial. To plan ahead, you got to do something. So that's what we learned.
I want to interject something. My mom, if you read the book, we tell my mom's story. She had her tonsils shrunk by X-radiation as a child. And later in life, much later, she developed a brain tumor. When the brain tumor came out, she had a lot of residual issues. My folks were living in a condominium that had stairs. My dad's had a lifetime of back trouble, and now my mom was a fall risk. In the market, the real estate market was in the tank. And he said, we have to move. And everyone said, you can't sell your house, you can't. He said, but we can't live there because we're not safe. Because he knew that those stairs now changed the whole dynamic. And I remember thinking, oh, did we lose our presentation? Oh, there it is. But that was the right decision. And if they hadn't made that one, then I would have known that there was a problem. I'm going to let that go. People often ask, how do I know, when the time has come to step in and make it, help my parent? And if the person is always saying to you, I don't need your help and I'll let you know, you're going to need to take some steps, because you know that the person is not doing well. You can see objectively that they're pushing you away, but they need your help. They're claiming that they want to remain independent, but they're growing more dependent every day. And so that's one of the myths, and that's why we decided to call the book, When I Need Your Help, I'll Let You Know. Because has anyone ever heard that before? Probably no. All right, let's see if I can't find where we are.
Yeah, bring that back.
Okay.
One thing we didn't learn is how to run a computer.
Well, this is in our computer. No, I've lost it. Okay.
Yeah, you did too.
All right. Okay. So when we wrote the book, one of the things that I wanted to do, because I'm an elder law attorney, was to put the problem of people refusing to accept help in some kind of a context. So everybody knows about the baby boom. 76 million of us born between 1946 and 1964, retiring at the rate of 100,000 a day. And if people are also experiencing ill health who aren't in the baby boom, so the numbers of people who are going to need help, who need it, going to need it in the future, is just ballooning. We've also got the demographic experience of an increasing number of single family households. People, had higher rates of marriage, or they maybe lived with families. That's not so much the case in our day and age. And so we were thinking about the issue of care, in the context of how are people going to pay for it and where are they going to find that care. The other issue that we talk about in the book is that seniors and people who are experiencing any kind of incapacity are highly susceptible to fraud and financial exploitation. And this determination to live alone in a home sets you up to be exploited. I know that that's not what people want to hear, but it's the truth. As you get older, you lose some of your processing ability. People become, they get a phone call every day from somebody who's asking for money, and all they can think of is, I'm so lonely. This guy calls me every day. If I give him money, maybe he'll call me tomorrow, because the kids aren't calling, right? So there's a great danger out there, and that was one of the other issues that we wanted to explore, partly because my parents' experience in a congregate care facility was so positive, both for them and for me as the caretaker. Okay? You want to talk about the myths in our society?
Take the one, the title of the book, When I Need You. This is number 1. And then you're going to talk about number 3, I think.
Yes.
Okay. So the problem, let me start in a different place. When we're little, there are myths to help us cope with life. And I'll use 2 examples to make the point. One of them is the tooth fairy, and the other one is Santa Claus. The tooth fairy, because when your teeth fall out, that's a negative experience, and the tooth fairy makes it positive. And of course, I don't need to explain Santa Claus. The thing is that all people in all cultures have myths that allow them to process the difficulties of life. And when we reach the older years, there are myths also, and this is one of them.
The reason it's a myth, the reality is, if you have dementia and you need help, will you be able to ask for it? Will you know you need help? I brought my mom clothes. She used to look, she was Nancy Reagan. She always looked just perfect. And after a while, her interest in such things began to decline steadily. That showed me that there was a change in her. If you're a person who's always lived, you're disheveled and you've never cared about where you lived or how you looked, that's a lifestyle choice and you're entitled to it until the moment of your death. But if your family notices that you're a person who always took care of yourself, always took care of your home, and all of a sudden now things are slipping, that indicates that there's a problem. And as I said before, people are always searching for that bright line. When do I step in? And I think you step in when you see a change that the person is not aware of. When you notice that things are declining, even if the patient, in your case, says, no, I'm fine, you know that they're really not. That's when you need to become a little bit more assertive. So in the book, what we did was, for each of the 5 myths we identified, we posited the reality. Okay, so when I need your help, I'll let you know. The reality is you won't know when you need help, or you won't be able to ask for it. And then what we did was to create for each myth a section that we call Tools for Caregivers. So if you're working with someone who's not well and they're pushing back and you don't have a power of attorney, that's the first thing that you need for the person you're trying to help. And so in the book, the Tools for Caregivers goes into what is power of attorney and how you get one and how do you use it, what are the limits. Okay?
But let me just interject one thing. For each myth, we also looked at what we called soft and hard issues. Soft issues are feeling, and they can be on the part of the individual or the family. Example, well, we haven't gone to the will, but let me use that as an example. Somebody doesn't want to draw up a will. Why? Well, in some cases, people think that drawing up a will is actually kind of like a jinx. You're actually bringing on death. It's nonsense. Or I don't want to spend all that money. The money that you spend to get a will is nothing compared to what you could lose by having a badly drawn will, or none at all. So we have soft issues, how people feel, whether there's going to be fighting between members of the family, or hard issues are measurable things. I'll give you an example of a measurable thing. A person is becoming handicapped by illness or dementia, and you can say, is this individual capable of feeding himself, clothing himself, dressing himself, bathing, toileting? Those are all measurable things. And that's what makes them hard. It makes them different from feelings.
So in the case of the first myth, which is when I need your help, I'll let you know, the soft issue for the family might be, this is my spouse, and we've always said that we would take care of one each other, you know, for better or worse. What am I going to do? I can't break that vow. My sister lives in another state, and she doesn't want to understand the condition of our sibling who's not well and who's been living with me. Or some siblings are having a fight over who should control the decision making about this ill person. And again, a hard issue would be, can I provide, or can anyone provide the services that this person needs at home in an adequate and competent way? That's the hard issue. Mm-hmm. So that's how we want to present this to you, because we want you to go out and buy the book. So we can't tell you too much about what we've written. But for this group, sometimes we do talk. The fifth myth, which is one that always just gets me, is I don't need to do any estate planning. My kids will figure it out when I'm gone. And if you knew kids like I do, you wouldn't say that. But I thought what was more important for us to talk about tonight was our third myth, which is, I want to die at home. When I'm ill, when I'm dying, I want to be surrounded by my family, and I want them to be my caretakers. So let's talk about the soft issues.
Yeah. Soft issue for sure is going to be, will the family be available, and will they be willing to be there? And what are the relationships between siblings or between the parents and the children? Because they can essentially destroy this wonderful idea of dying at home surrounded by the family. That what that requires is, in many cases, in many families, a miracle that isn't going to happen.
The hard issues, and we try to outline in the book what I call a home-based care plan. So think of all the issues that need to be dealt with. Number one, I would say number 1, 3, 4, and 5 would be money. So can you afford to live at home? If you have a house, is it safe? Does it have to be modified, and in what ways? If the house has to be modified, can you stay there while those modifications are ongoing, or do you have to be out? Well, that's an expense. So how do you pay that? Okay, so now we have the house modified. What are your current care needs, and what are your emerging care needs? You have to have a future-looking plan. You have to know how you're going to get your food and your medical care, occupational therapy, physical therapy. You have to have somebody who's going to take care of the house, go food shopping, and pay the bills if these are things that you can't manage independently. And then there's the issue of socialization. And I think over the last 4 or 5 talks that we've had, we've realized that that's not in the book as much as it ought to be. But the benefit that we all get from connecting to other people is really lost if you're living alone. I had a client who was stuck upstairs in her home for 10 days. The stair climber broke. So the neighbors brought her food, and she was just up there. And at the end of it, I said, let's get you moved. She said, what's wrong with that? I said, you were alone for almost 2 weeks. She said, I saw my caretaker twice a week.
That is not socialization.
That is not socialization when the only conversation that you have is about your illness. That's not socialization is when you sit down and talk about your friends, grandkids, or their trip to New Zealand, or where you're going, or where you want to go. And come on in. ARP had an article recently that my dad brought to my attention about the benefits of socialization on mental health. And if you're fighting illness, your mental health is just a critical part of your ability to be well and to stay well. So we don't talk about that enough in the book, but it really is critical.
Yeah, let me just throw in one additional issue in the home care plan. The person who is living in the home alone needs medical attention, at least ordering medications and making sure that the medications are given and taken at the proper time and the proper dosage. Question: is there a provision somewhere in the plan for an alternate in case the nurse calls and says, I can't get out of my driveway, my car won't start, and I don't know? You could fill in the blanks. There has to be, in the plan, there has to be a provision to take care of the emergencies. You can't just assume that everyone is going to come exactly on time, because you know perfectly well that won't happen. And so it's all the things that Barb said and more, but on top of that, there has to be some kind of provision for that emergency. And one of the things that's discussed in the home care plan is something called a nurse care manager. You want to talk about that?
Well, if you're trying to manage somebody's care and you aren't yourself a medical professional, it can really get away from you. Because I'm an attorney, I deal a lot with families in conflict. Usually when there's an ill person, the conflict is over the flow of information. They say information is power, and I guess that it really is. And so when there are conflicts and there are difficulties in knowing how to manage a client, a patient, or in managing conflicts between family members who have different thoughts about what's best, this nurse case manager can be really invaluable because they're neutral. They're professional. Their focus is only on the needs of the patient. They're not going to go back and revisit the historical hostility between, the siblings, which is what's coloring their decision making for the parent. And that families are wonderful, and I hope we all have them, but they can also be difficult when you're employing them to take care of a sick person. I took 3 months off of my job to take care of my mom as she was dying, and as my dad said, he was very, very ill at the time, and so they needed me, and I couldn't have gone to work anyway because there was nothing else I could think about. And I'm very lucky because I'm a part owner of a business and I was able to do that. Many people would have lost their jobs. They just wouldn't have that kind of flexibility. And it's very difficult for family because that's what you want. That's what we've been trained to do, is to take care of our families. But the other problem with family is that not only can they not sometimes be trained, they can sometimes lack understanding of what the patient needs. I had a client who had a swallowing disorder and he had a granddaughter who was smuggling him fried chicken. She just didn't understand. The other problem for families is if you take one person in the family, say they're going to organize the scheduling of the care, when someone drops out of the schedule, isn't that person's going to get roped back in, and so it can be really, really difficult. There's obviously a role for the family to play, but it's very difficult to be a one-on-one caretaker. And so even though in our hearts we want to do that, it's very hard. And I wanted to say one thing, and then I think we can wrap up. My folks moved to a congregate community, and they were there for 6 years, I guess. And people had a chance to know my mom. She got Alzheimer's, and by the time she died, she was a completely different woman than the one who had moved in. But the benefit for me as one child taking care of two critically ill parents was that I would get a call that they had fallen. I didn't get a call that they were on the floor, right? The facility, the community director would call and say they're fine, they're back home. Your mom fell, your dad fell. One day he fell on her. That was a great time. And so it enabled me. I don't know how I would have managed without them being in that supportive environment. If it had only been me taking care of two very, very ill people who were alone, I would feeding them, clothing them, bathing them. I think it would have been a nightmare. And what happened was, after my dad got well, he was in a rehab in his community for almost 6 months. We just looked at each other and said, what would we have done? And it made us think about this resistance that people have to leaving home and, going into care. And of course, our book was written more for seniors, and we specifically wanted to address that situation. And people who are ill, that's a different dynamic, but there are many, many similarities. And one thing that we did decide is that when you don't act, you're acting, and very often putting off these decisions makes them so much harder. My client, who's been sitting in the upstairs of her home, she has grown less and less accustomed to being with people over time. And I think she's afraid. She's going to have to sit down at a table with people and socialize, and they're going to expect something from her in that conversation. So our pitch is, do these things sooner when you can become a part of a new community, and get to know people and have them know you and provide that kind of support to your family.
Well, we began by saying, how could we write the book? At the end of it, we thought, this is a different question that we should pose. Why was the book necessary? And we concluded, among other things, there is no such book other than this one around. Literally, there isn't another one around. It had to be written. And of course, now that we're beginning to get some feedback, God help us, I can already begin to see a second edition.
He'll be 88, so we want to get it done,
I don't want to put this off. Maybe this is time to say,
Questions?
do you have any questions?
Has anyone bought? Well, you bought the book. Have you started?
I've made 3 other people read it.
Oh, thank you. We really appreciate that.
Yeah, I appreciate the way you structured it, where you say, okay, these are antidotes, these are checklists.
Right.
This is what you can do
Right.
to respond to it. Because
Well, I get a lot of...
have we done this yet is
Right.
a real good question.
I get a lot of calls from people about, their parents, and it's usually, my mom, my dad, they're falling apart. They won't admit, they've got an illness, whether it's ALS or dementia, and, they're not accepting of it. They're not working with the kids. Their lives are crumbling, and the children are deferential. We've all been taught, you don't say, this or that to your parent. They're older. I mean, I've seen grown men just quake at the thought that the little old ladies who are their mothers will be angry at them. And all they're trying to do is make sure that they're in an appropriate and safe environment.
Well, one thing I was surprised you didn't mention in the book is the dynamic of, if you're looking at your parent going through something, it's all too easy to imagine yourself in the same circumstance.
Mm-hmm.
And that's huge.
It's huge. Right. My experience has really been positive, and I laugh, but I mean, I am fully planning to take his apartment when he doesn't need it anymore, because I see the congregate community as one that's really lively. I'm single, and I don't imagine that's going to change. My kids don't want me living with them. So I look at this as, for me, I'm thinking, this looks pretty good. You know, there are things to do. There are people who are there when you need them. If you want privacy, you go shut your door. You know, there's no one forcing you into anything. But I like the idea of being surrounded by some kind of protection, you know. Has anyone had to make that kind of a choice yet? Yeah.
Put my mother-in-law in a very nice congregate living
Yeah.
situation, and everyone is thrilled with the outcome,
Yeah.
including her.
Oh, that's the best.
Yes, but I think one thing I would say is it requires extreme patience on behalf of everybody, because to get the whole family, or the people that need to make the decisions, all on the same page, can take some time.
Yeah, planning by committee is really difficult,
Yeah.
you know. And I think there's a lot of fear involved. There's fear that people won't like you. You know, if you've lived alone for the last 20 years, you know, there's a fear that, you know, you won't fit in, or you won't like the food, or they, you know, fear, and it's all this. And what I see people doing, though, is staying in a situation where their standard of living is declining, and they're accepting it because they're so afraid. And I don't know how to help push them through that. But I think that, you know, you want better for people.
I apologize, I got lost and so we were
Oh.
late. I'm sorry. I'm just wondering, have you talked about types of facilities and all, or what did we miss? Not that you're gonna
Didn't
go
talk
all the way.
about that, but you know, Washington State is one of the few places that we have nursing homes, skilled nursing facilities. We have any number of residential, like what yours is called an active retirement community.
Well, they call it a continuing care facility. It isn't really, because at the highest level, they don't have skilled nursing. And you really should have that in order to get that title. But
there-
it's pretty close.
So in the place my parents lived, if you go to the hospital, say you had a hip replacement, you can come back, and they have a health center, so you can do your rehab there. So your friends can come and visit you and that kind of thing. Washington State also has adult family homes. They're private homes where you can have up to 6 residents, and they're licensed by the state. And that's an option that a lot of states don't have. We didn't really talk about that. We didn't talk about Medicaid. That's, you know, and how to pay for care. That's something that we can
Let me
do.
just say something to make sure that we get this straight. We weren't advocating for a specific solution. We were simply saying, here's a problem that needs to be addressed, and let people make that choice.
Right.
I had breakfast one morning with a guy. We always had breakfast together, and I was telling him one day about the book that was being written, and he said, "You're advocating that everyone should come to our place." I said, "No, I'm not. We're not. What we're saying is that everyone needs to review the situation, and because there isn't a one-size-fits-all. Cannot be.
There was a guy, he said the other day, 95, asked if he thought it was time for him to get a power of attorney for himself and his wife.
I couldn't believe it.
It could be.
He says, I need a power of attorney, I can't get it for Ira. She cooperated and passed away.
I think that since we're all dealing more with ALS and
Sure.
thinking about that tonight, and how it applies to us, what we're really looking at is a progression in the amount of care that is abundantly more than most elders require. And so not many adult family homes are able to help with that. So looking at the specific level of care that any place can provide, and then whether they've ever had any experience with ALS
Right.
is another issue.
Right, because it's very specific. Yeah. Do you know, are there any facilities that do specialize in?
Not to my knowledge, no. There are some adult family homes in the different regions, and the care coordinators try really hard to find these. I know of one adult family home that takes vented patients all the way down in Battleground.
Okay.
That's the only one that I know of in that case. Otherwise, it's skilled nursing care for vented folks. It's such an individual issue for most folks. What do they have for family, for resources in their area, and willing. And I see a lot of folks putting off that decision because they just don't foresee a better option for themselves. And there are very few places, my mom just moved into a facility, and we were looking at the different ones, and I kept thinking of ALS patients as we were doing this. She's an independent senior, and it's a great community, but it doesn't provide, they provide housekeeping. And so it's great for her, but if at any point she's going to need assistance, then we either bring it in or she has to move. And the costs are astronomical for folks going into that care.
Yeah. When my mom, we talked to them because she had Alzheimer's, it was $13,000 a month for her to be in the dementia care unit. But that we was just going to get a box and go under the freeway. It's shocking, and you have no idea how you'll pay for it. Looking ahead, and of course, you think, well, I have another 10, 20, 15, we don't know. You think, how will we afford this? And we don't know. But I guess, our thought is to do the best that you can to know your money, and then do the planning, get as much information, and be as hard-nosed and as realistic as you can.
Because as we've said at the beginning, if you delay it, defer it, it's not going to get any better. It only gets worse.
Right.
And stress, there's so much more stress involved. This is one of my talking points, because stress is hugely detrimental. To all of us, but especially to ALS folks. And so being proactive is less stressful. It doesn't necessarily feel like it, but that's always my my soapbox a bit.
Well, being in control, trying at least to take that control. And I think people sometimes feel that they're asserting control by saying, no, and pushing back. But they're really undermining their own best interests. And that's what makes it so challenging. Because we all do have the right to fail. Everyone has the right to, not get medical treatment and not do well. But it's just not what you want for the people that you love. And that's where we come in, And I guess about estate planning, which would absolutely apply to people with illness, it's not that expensive to do estate planning. It is very expensive to not do estate planning, especially if you have people that you want to benefit who are children. In King County, the court will appoint a special person called a guardian ad litem to represent everyone under the age of 18. And if you don't have a will and you don't appoint a personal representative, someone's going to have to go into court and ask to be appointed to administer the estate, and they'll be put under the watchful eye of the court, which means that every decision they make has to be run through the court and is going to cost money. So planning your estate is something that it's a gift for your family, and the cost is absolutely nominal compared to the cost of not doing the work, as it is in all these things. I think that's the underlying message. Not acting is acting. You're taking a stand.
So your advice is to plan and maybe look at facilities and kind of, even if you don't need it yet, to make those choices?
You gotta plan ahead.
Right.
And in the case of an individual, let us say you have someone in your family who is wishing to live at home. I think, I didn't write this particular section, she did. It's a phenomenal home care plan, and with lots and lots of issues, questions to be answered, and not doing it is leaving that individual literally exposed to risk.
So are you advising to get help with the plan, or just do the plan?
The only persons who can do the planning properly are the family, because they know,
Okay.
let's say you begin, how much money is there available? And then you start looking at what is needed and get it all on the table.
But my folks were part of a group, and again, they didn't have an illness like ALS, which would make the need to do this much more pressing. But they did get together and they decided to review the different options for congregate living in the part of Seattle where they live. And so all these places want you to come in. And so they just kind of went through all the different communities, and more coming up all the time, so that you get a sense of what they offer, what you like, what kind of food do they have. And we're talking to a place in Bellevue. They're going to start offering, they have a community that'll have Chinese food because they're trying to attract a population. So, you can go in and see what kind of nursing services are available, what's the relative cost.
Can you assume that every one of those facilities is going to be ADA compliant and like wheelchair accessible in all the rooms?
No.
I guess no. No. More and more, I think they are, because people are coming in now with assistance. Everybody's got walkers and canes. I mean, that's just the standard. So they're beginning to widen hallways, and but they are there to serve people who need assistance. So,
But you just raised a really interesting question. Is that home where the person is currently living, are those hallways wide enough?
Right.
And are there grab bars in the bathroom?
Right.
Yeah. Well, and like in my apartment searches for
And on and on.
Seattle says that a lot of them are ADA compliant in the rooms, but then I don't know if that's assuming that then the bathrooms are wide enough. Is the kitchen ADA accessible?
All right.
Is the room? So it's like, how do you even search to make sure that a wheelchair, because it's assuming that.
Well, and when they say that, I don't know what that standard is, and that would be a really good question. maybe now there is a better standard for how they have, so that the doorways are
I think
wide.
the facilities that are being constructed
Yeah.
today,
The newer
you can almost be certain
Yeah.
they're okay.
Yeah.
We've, with hotels, it came up for me where they would say they're ADA accessible, but not wheelchair accessible. And that was the term that I figured out finally.
That's what you have to say.
Because it's a different issue.
It is,
Oh.
It is definitely.
Okay.
Because unless it's wheelchair accessible, it will still have thresholds and,
Right.
and
Probably a shower
probably
or
a shower in the tub.
It'll have a grab bar.
And grab bars, which may be in the way
Right.
for someone in a chair.
Yeah.
Yeah.
Mm-hmm.
Often I don't think you know until you look at it.
Remember the night Mom pulled the grab bar out of the wall?
Oh gosh.
So with our ALS folks, living at home, certainly for the ones who are married and have family living in the home, it seems to be in a more affordable and more satisfying. And so the cost of doing some minor modifications, in some cases not so minor, to make the home livable is probably more common and more of a recommendation for those folks. So, but thank you for reminding us
Well,
that there
and
are other places.
There are places, and if you decide that you're going to care for someone at home, there is a home-based care plan. And the idea is, if you want to do this is something that you should do and have all the support in the world. Here are the things that you want to think about. Here are places you can go. You can look online to get, care plans that go on for pages. And you really ought to look at these because you want to know what you're taking on. Best information is full information. And we aren't saying that you shouldn't come together as a family and take care of I wouldn't have had anyone else take care of my mom or my dad. And they were at home. They were just at home and inside this larger community. But I think for people, and especially when it affects younger people who don't want to go live in a community, people where the average age is 88. That makes all the sense in the world. So in that case, all we wanted to do is provide you with the tools. So that would be healthcare and general powers of attorney, so that you have the legal authority to take care of this person, and you give it to all the doctors. So you've got, you're HIPAA compliant. Maybe you do need to get in somebody, a nurse case manager, because maybe there are conflicts in the family. That's great. Those are professional resources that will help you. And also, as the patient's needs change, progressive illness implies changing needs and higher level needs, so that professional would be able to come in and say, okay, this is what we need. So we aren't at all opposed to it. And I think, my mom died at home, and that's on her own terms, with the cat right beside her, and that's what we wanted. And everyone should have that option. So, and that I hope that part of the book, those pieces that speak to that, will be really useful.
Do you address that all, how to hire caregivers?
We do. I talk a little bit about, getting references and what to ask for. And I would think that if for someone with, with ALS, you want to ask specific questions about their experience, and background, and neurological illnesses, and, maybe their willingness to take a training class, right? Because as someone's needs change, they may need venting, and that might not be an experience or skill they have. So, are they willing to go along with this?
I think that's where part of the planning ahead is really important, especially with ALS. In our experience, we kind of decided to dabble a little bit into home care, and it was very quickly apparent to us that we had at least 2 different caregivers come that had, even though we had been very thoroughly interviewed by the agency that came, neither of the healthcare providers, the helpers that came, even knew what ALS was. And so I would say that I would agree with Marilyn that I would say the majority of ALS patients would like to stay at home because the care is so specified, and it's not commonly known in the healthcare world. Whereas within our ALS community, through the care services coordinators and the other things that are available, it becomes more apparent exactly what you need. But you don't want to wait too long because you have to train your caregivers. And in our case, we didn't have time to do that. And, you know, looking back, it doesn't, the idea was to give me a break, but I wouldn't have left my husband or anybody who came to the house because they didn't know what to do. So something that I think is important, if you do stay at home, which that certainly was what we wanted to do, that's something that you would want to get ahead of, is finding someone and maybe training a person. Finding someone who's willing to come and learn about the disease and exactly what's needed. We didn't have time for that, but that's where planning ahead, I think, would really be important. It's an individual thing, and I don't blame agencies for not having that kind of training. Most EMTs don't know that an ALS patient shouldn't lay on their back. You know, I mean, those are the kinds of things that because it's rare enough that EMTs, 5 EMTs came to our home one day for an emergency call, and they were all 5 the deer in the headlights. They had absolutely no idea. I ended up having to transport him. They didn't know he couldn't lay flat. And so these are the kinds of issues that we deal with in the ALS community, is just a general lack of knowledge in the medical community and in the healthcare community. It's just something we have to work at as advocates for
patient advocates.
for our family members.
It's worth mentioning, though, on the nurse case manager, as they go through the checklist of activities of daily living, state funding can start kicking in.
Do you know about COPES? We don't want to go too far afield, but you know, there is money available sometimes for in-home care, right?
But not for the spouse, isn't that? Not for the spouse.
Can the spouse be paid as a caretaker?
No.
No,
For
okay,
COPES, no.
okay.
Not yet.
Not
We're
yet.
working on it.
Oh,
There's-
fabulous.
There's actually a bill, people working on it in
There should
Olympia
be.
at the moment.
Yeah.
Any other relative?
Okay, any other relative? Okay
But
then.
not for the spouse.
Yeah, I mean, I could come back, we could do a whole thing on
But-
Medicaid and
but,
COPES.
you know, I go into several homes where the spouse is there,
Yeah,
but the outside caregiver comes in because of the person, so the spouse is not paid per se.
Right.
But they don't have to do everything either.
right. So the state of Washington will pay some, they'll pay for a caretaker to come and provide some level of services to you in your home if you meet certain requirements.
If you qualify.
If you qualify,
Which
yeah.
means, you really have very few resources of your own left.
Well, call me if you're
qualify.
married, because there are a few tricks in the book.
When does that, so how do you learn about that, or how do you know when you can do that? I mean, we're a year into ours. He just quit. He's been a month off now since he went on disability. He can't even get Social Security disability for 6 months.
Okay.
I have to work a full-time job.
Right.
I'm the only income,
Okay.
besides his short-term disability through work. I don't have a choice but to be at work every day.
Right. And so the state of Washington will allow you, and there's some income limits, but it's like if your husband would have to earn $6,000 a month or more. So it's usually not a problem. And then there's some limits for your assets. You know, they don't, and I'd be happy to talk to you. I'll give you my card and you can call me. And there are some websites I can send you to. But you can qualify for some in-home care. It's not 24 hours a day, but I think it's up to 180 hours a month. So, that's 5 hours a day. It can really help. It can make a big difference.
Well, yeah, our biggest thing right now is like meals. He can't.
Oh, yeah.
His hands and arms don't work.
Right.
So he can't. I usually at night make all of his breakfast for the morning, so all he has to do is heat it.
Mm-hmm.
But when it comes to making his lunch, there's nobody there, so it's kind of like we're trying to get things that are easy for him to be able to, throw in the microwave if he can. But he can't open packages, he can't open containers, he can't open bottles, he can't, those kind of things. Trying to get himself dressed is a difficult thing. We're still working through that process of him being by himself during the day. So getting on socks, he can't really do. Getting on pants, we get sweats because he can't do buttons. He can't do a zipper. He can't go into the bathroom. That's another thing. It's getting harder and harder, TMI, but to, wipe himself. I'm going to look at getting him a bidet, and everybody says that's a huge, wonderful, helpful thing.
It is, yeah. I hate to say so, but we got a dedicated one with a remote.
See, this is the problem. We just sold our house a few months ago, and we moved into leasing because we didn't know where we were going to be financially after everything. So we're leasing a place. I don't know what the rules are as far as what we can make them do, or if they can't, to help accommodate, for those kind of things. Because the bathroom we have is like this tiny little bathroom. To plug something in, the outlet is all the way across the bathroom. We're gonna have to run a line to put in the T on the toilet to hook up the bidet. I have to ask the leasing agent if that's okay, if they'll allow it. I mean, the restrictions on going into something like this is like, we're in this whole new game and we have no idea what to do.
Right.
Could I ask you a question?
Yes.
I have some issues with my hands, and I have access to an occupational therapist, and she's helped me identify things that I can use to make my problems easier. Do you have access to an OT?
A little bit, we're getting into that because we go to AL's clinic.
The reason I'm asking, if buttons are a problem, and boy, they are for me, I'm using them, but I've determined that I'm going to do it. But I know that Velcro is available, and there are other solutions, and I want to make sure that you have access to those things.
We started like shoes. He can't tie shoes, so we got them elastic, and that seems to be working really well. His buttons on his jeans, I took actually a hair tie. A scrunchie, or not a scrunchie, but elastic tie. Yeah. I loop it through the buttonhole.
Okay.
And tie it off, and all he has to do is just take a finger and flip it over the button. So
that's fabulous.
It works.
Yeah,
It works
right.
really well.
I'll get your name and I'll talk to you, and I can send you some information on this COPES program.
Okay.
Again, Washington is really progressive in some ways. So we have Medicaid, and that is nursing home benefits for the state of Washington. The COPES program allows you to get in-home care. And it provides a budget. So, and for you guys, it might just be perfect. Somebody come in, help with dressing, get the lunch on the table, be there, and then, you come home, you feel like, this is good, he's okay, he's had someone in here, and it would help you both, your whole family. And we can talk about qualifying and the whole process. Okay.
You're also connected with the Area Agency on Aging. So the King County, you're in King County, right?
Yeah.
So at least in Pierce County, I'm not as familiar with King County, but I think they have more resources than than we do in Pierce County, but there's a lot of programs, and what they have done is send a case manager out to see what programs are available to you,
Okay.
Nice.
including any kind of Medicaid programs, COPS programs, volunteer programs.
Okay.
They usually have a respite, they have anyway, have had funding for respite grants and some equipment. And so I always think it's worth checking in with the county, well, you know, it's a state program.
Yeah.
but It's the Area Agency on Aging in King County.
And King County does have one, I know they're,
Yes.
you know,
Yeah, I think we
pretty active.
have to. Every county has to.
Oh, okay.
Yeah, there's a.
That, I mean, that kind of resource could be great, you know, because they'll know about programs, and resources that we might not, you know. And it really is, it's all about getting information and, you know, connecting with people and finding the resources that are going to be helpful for you. I think, you know, no matter what illness it is, you know, that afflicts you.
Well, I sure appreciate you guys
Well,
coming. I have to
thank
say,
you for
When I saw,
coming.
I heard the title, it really made me think of our caregivers, I have to say, right?
I know.
You know, because I think that comes up a lot.
Yeah.
Caregivers not being able to
Right.
recognize when they need help as well.
That's a very good point. And everybody will say, oh, and who's taking care of you? And I remember thinking, oh, yeah. You know, caregiver, you just keep going until the crisis is past, and then you move on to the next one. So.
Thank you so much.